Thank you very much, Mr. Chair. Good evening, distinguished participants. I just want to take us through the effort that the government of Nigeria has made on preventing maternal mortality and a series of efforts that the country is making in promoting SASA cooperation. There are a series of strategic approaches that which we have embarked upon, such that our membership of PPD will definitely impact on whatever may be the objective of PPD and what the mandate of PPD is to achieve in member countries. So my presentation will go on this outline because of our time. I just want to say that Nigeria, as we all know, is the largest country in Africa, and with a population of about 214,426,654 as at July 2019. That's the estimate from the 2006 population census. We are working towards another census, but currently we are using the 2006 census figure to arrive at the current figure that we have now. So it's a projected estimate. And the maternal mortality ratio in Nigeria is 576 per 100,000 live births. And we are saying that we are consolidating on the gain of MDGs, the gains we had in MDGs, to make sure that in this SDG, we are targeting our target of not less than 70 maternal death per 100,000 live birth by 2030 is achieved. That's the aspiration. And so going by the concept of maternal mortality, I don't need to take us through that because of our time, but ordinarily we are key into the international definition of maternal mortality, particularly the one that was given by WHO organization that says within 42 days of termination of pregnancy, that the death of a woman while pregnant, or within 42 days of termination of pregnancy. You see, it's usually very sad when somebody died as a result of pregnancy or died, 42 days after giving birth. And some of the factors that we identified that are contributing to this include education, there's lack of education, the culture sometimes, our cultural values, and the lack of access to health care and skilled health workers. There are some other factors, but some of them may be as a sort of the places of residence, particularly those that are living in the rural areas. You see, in the rural areas, most of these facilities are not available. Where they are available, you see that, the services, those that will provide the services are running away from staying in the rural areas. So everybody prefers an urban area. So it actually has a lot of implication on the populace and on our women. So I want to take us through the trajectory of maternal mortality decline in Nigeria. So, the ratio decreased between 1990 and 2013. And because Nigeria used to have one of the highest rate of maternal mortality, but at the same time, with proactive measure of the federal government of Nigeria, then we had now had the highest rate of decline in mortality among the African countries. From 1,500 per 100,000 live births in 1999 to 576 per 100 live births in 2013. You can see that it's a reduction of about 3.3%. And I can assure you that the gain made since that time is quite promising, and it's been sustained. Just to address the unacceptable high maternal mortality in Nigeria, that is ranking among the highest in the world in the past. So the Ministry of Health, since 2017, has actually reestablished the commitment to bringing it to a end with the inauguration of a task force that will address this menace. Then we have some of the factors that are identified as causing maternal mortality in Nigeria. The most common cause of maternal mortality in Nigeria, maternal death, is heavy bleeding that is following delivery. That's hemorrhage, which account for about 20% of maternal deaths. Then we also identify infectious diseases that are following childbirth, that's sepsis, which was put at about 17%. And basically, the following are also identified: unsafe abortion. A lot of teenage pregnancies, abortion arising from unwanted pregnancies. So some of them are unsafe. Some of them go through quack means. Some of them go through an unwarranted means, and which eventually lead to their death. And then another one is the toxia, which eclampsia. And then malaria too. I mean, malaria is a big disease that we see it as a small insect. We see it as a small thing, but it's a killer disease. Malaria has a lot of negative implications on the safety of pregnant women. Then obstructed labor, protracted labor most of the time, which is caused by factors that is beyond the control of whoever has it. And you can see that this is common in developing countries, and some of the rural areas are actually still experiencing this unwarranted the anemia too. Anemia arising from bleeding, the hypertension. You see, some of those things that we don't put our mind in, they are those things that actually affect our women when they are pregnant. And we have identified some of these things, and it's been given critical attention by the government. It's like, why the government recognize the importance of reproductive health, then maternal mortality death, and then the population, the nexus between population and development. Because if we don't look at some of the factors, the inherent factors that are actually causing this thing, we overlook them because we consider them as not important, whereas they are very, very important, and they cause a lot of havoc, especially among our women. And then other causes, there are some other causes which we cannot enumerate here. Then we have the government of Nigeria as a sort of this. It's like declaring an emergency on a particular situation. So we have a combined effort of the government, the private sector, our development partners, and you can see the World Health Organization in Nigeria and the other partners. They are supporting the government of Nigeria to develop and adapt various guidelines and policies that we on reproductive, maternal, newborn, and child health. And then we can see from the year 2000 and 2015, the maternal mortality rate in Nigeria reduced from 1,170 deaths to 814 deaths per 100,000 live births, which is about 30.4% reduction. And then WHO, with the support of Bill and Melinda Gates Foundation, is providing technical support for implementation of policies and guidelines in selected states. Some of these policies and guidelines are to support the subnational levels of government to actually address maternal mortality. Because if effort is concentrated at the center alone, it's clear that the smaller states, the subnational levels of government will suffer. So as a result of this, most of these efforts are decentralized, such that every state of the federation will benefit from it. The Federal Capital Territory, the Sokoto State, Kebbi States, these are some of the states that are actually under that are benefiting from some of this initiative. There is also in pipeline a maternal and newborn quality of care, which the initiative is to be supported by partners, which will be led by WHO Health Organization and UNICEF. It's already concluded, and it will focus on instituting quality improvement in selected health facilities. Most of our health facilities that are dilapidated or that are having one challenge or the other. So this quality of care initiative will definitely address them. Then we have some efforts, the current effort of the government of Nigeria to address maternal mortality and mortality. Number one, increase in antenatal care from a skilled provider at 57% visit of 4 or more during pregnancy. At least there will be a visit of at least 4 or more of them during pregnancy. This is being established such that they will be able to quickly identify what may likely be the cause or causes of, what might be the cause of maternal mortality, so that there will be safe delivery at the end of the increase in health facility birth delivery at 39%. We have about 39% increase in health facility, for birth. Therefore, 3% of the birth delivery were delivered by skilled providers, and midwife services scheme in some states like Cross River and some other states are actually established. So let me quickly go to the SASA Corporation as a tool for addressing maternal mortality in Nigeria. The government of Nigeria, we align with the principles and the tenets of SASA Corporation as a catalyst for promoting healthcare delivery, particularly reproductive health and maternal mortality. And we have a lot of initiatives. We have the Technical Aid Corps that are actually handling, support to other broader African countries. We are supporting some of the countries in Africa and in the Caribbean, and by sending professional nurses, professional medical doctors, that are specialists in handling maternal issues. Then we also have Nigeria also recognized as a corporation as a strategic approach to have a wider coverage of reproductive health delivery across all relevant sectors. With that, Nigeria, as a member of PPD, has inaugurated a national task force of relevant ministry, departments, and agencies that are actually addressing this, so that each of them will come together. So at the end of this conference now, that task force will have this, the outcome of this conference will be cascaded into their annual work plan. Especially those that are relevant to the sector, the health, the population, and some other area. And Nigeria also, we are a member of SASA's Network of Public Service Innovation as a strategic approach for improving public service, focusing on experience sharing and capacity building. And then government of Nigeria is ready to partner with PPD and government of China on community clinics in selected areas to improve facilities that addresses maternal mortality and improve reproductive health in Nigeria, particularly in humanitarian setting and among the internally displaced persons in the areas affected by the crisis. We are also open to partnering with countries and scaling up our Center of Excellence. The National Population Commission of Nigeria has an institute that can be promoted, that can be upgraded, which we are working on now. And I believe that with our partnership with some other country, this effort will actually materialize. Thank you very much.
Thank you, Nigeria.